Together we achieve victory over heart failure.
Hello, this is Dr. Jignesh parikh. I am a consultant cardiologist working with Platinum Hospital in Varje and Devani Hospital in Danukar, Kothur area. I've been practicing cardiology for the last 5 years or so, and I see variety of patients, and I get to do all the kinds of procedure, coronary intervention. So today I'm going to talk about topic which is called heart failure, and you might be knowing about this terminology. In India, majority of patients with heart failure are surprisingly young individuals. It's common occurrence in to witness young adults seeking medical assistance for heart failure, whereas in Western countries, the heart failure diagnosis is commonly with the elderly people. So let us discuss on some points. Firstly, what does it mean when I say heart failure? It's a diagnosis. It doesn't mean end of life or your heart has failed. Of course, it means that heart pumping is reduced. We commonly look at heart pumping by 2D echocardiography and very important parameter called as ejection fraction, which we calculate by Simpson method. Normal value for ejection fraction is around 50 to 70%. Heart failure diagnosis we label when the person's EF reduces to 40%. And a person with EF 30 or less, they have significant symptoms at times. So when I say EF is less, it means your heart is struggling to pump blood effectively as it should do. Secondly, why do we, as an Indians, why do we get affected by heart failure mostly? So there are some important risk factors to it. Most important are diabetes, hypertension, obesity, smoking habits. All they contribute. Genetics also play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. That's how we get large number of patients with heart failure. Moving on, what are the signs and symptoms of heart failure? So common symptoms like breathlessness, you may feel easy fatigability. Breathlessness happens commonly on exertion when a person climbs stairs or when he exerts while doing some kind of exercise or walking. He may feel breathless as compared to earlier. A person may feel breathlessness in sleep. He may have to wake up in middle of night feeling breathless and starts coughing. It may take few minutes all this to come down. Another important symptom like chest pain while walking, which nobody should neglect, and palpitation. Some patients may develop leg swelling at their ankles. Few other symptoms which are non-specific like loss of appetite, vomiting, confusion, nausea, they are also common. But all of this happens in advanced stages of heart failure. Now, next important thing is how can we protect ourselves from this disease? So our heart works incredibly hard to keep us alive. Few points which I would like to highlight here. Important being early detection of heart failure through regular blood tests. We should do regular blood checking. For example, sugar level, cholesterol level. If a person who is already diagnosed with heart failure, he should check NT-proBNP level, ST2 level. That's how we can come to know about the efficacy of medicine and whether the disease is under control or not. Second being dietary adjustments to maintain healthy heart. We should consume low cholesterol diet, a diet which should be devoid of saturated fats. We should incorporate exercise into our routine. It has to be done regular basis. Practicing stress management techniques. We should completely stop smoking and tobacco consumption by any means should be stopped. Quitting alcohol also helps. And at the last, what comes next after heart failure diagnosis? What happens if somebody has got diagnosed with heart failure? So we should not lose hope. There are numerous modalities available, starting with medical management. Nowadays, we have good medicines which controls progression of heart failure. If a person has difficulty in breathing, swelling over limbs, he may get reduced with the help of medicine. Second, by doing interventions like looking at coronaries and treating if any blockages are present, that also help. And next is there are few tools which are available, devices like CRT or ICD. If a person has valve problem, he can undergo valve repair or replacement surgery. And last resort remains heart transplant. In India, in Pune, we are doing heart transplant on a regular basis. The lifetime risk of heart failure is 1 in 5 for both men and women. So remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.